Good morning, Prattle.
Good morning.
My name's Karen and I'm here to do your health check today. Firstly, could I just find out what you know about it? What are you expecting today?
Yeah, sure. Basically, what happened was I had seen some of the advertisements around the bus stands regarding health check. Now, I'm getting to around 54 and I've never had a check as yet. So I was thinking, something that's being offered, I probably would like to have that done, really, because I'm a bit concerned about the age I'm getting at now.
Great. Okay, so did you see this leaflet?
I didn't see the leaflet. All I saw was the advertisement on the bus stands. That was all.
All right. So in terms of what it's about cardiovascular disease and preventing cardiovascular disease, which are all these conditions here.
Right.
Had you thought that there was a connection between these conditions?
To a certain extent I did, partly because of my family history.
Okay.
My mum had diabetes and in fact she died of a heart attack.
So it's quite poignant for you.
It is, yeah.
Okay,
yeah.
All right. Well, that's quite significant and we'll talk about that a bit later. But the good news is that with changes of lifestyle, you can reduce your risk of developing these conditions. So what's going to happen today is that we'll do a very simple finger prick test. We'll take your height and weight and waist measurement. We'll take your blood pressure, and then we'll have a discussion about some of your lifestyle regarding diet, alcohol and activity.
Okay, lovely.
So it's quite a simple check. It will take 20 minutes to 30 minutes.
Okay, that's fine.
And if at any time you don't understand anything, please ask me.
Sure.
Okay. The last thing I need you to understand to gain your consent to continue is where your data goes. So all your information from today will go to your GP.
That's fine.
Are you happy with that?
That's fine. Yeah.
Excellent. So if you're happy and consent to go forward, we'll begin.
I'm fine, thank you. Yeah, let's carry on. Yeah.
Okay, great.